Good afternoon.
Hello. Hi.
So this is week 4. Today we're going to discuss pain, inflammation, which is a major cause of pain, but also a whole host of chronic diseases, and exercise. Exercise is very beneficial with pain and inflammation, but you want to be careful because too much or the wrong type and you can cause more pain and more inflammation. But first, let's talk about some of our successes about healthy living this past week. So who wants to share first? Flip a coin.
I actually cut back from an hour a day to a half an hour a day, and I'm finding out that it's much easier for me to maintain that.
Awesome.
So, yeah, I've been doing pretty good. And on the weekends, I've been really getting excessive. I mean, I've been hiking the heck out of the mountains up there.
Great.
But it seems to be working. Good sleep, good diet. We've been experimenting a little bit with cooking. So, taking turns between me and my wife. And
Awesome.
out ways too. So, stress management's good. A little book I've been reading too. It's called The Truth About Stress, and that's been helping too.
Excellent.
Identifying what's coming at me and how I'm reacting to it, and what beliefs I'm applying to my reaction before I react.
Mm.
And that's pretty much in a nutshell what this book's all about. Is that it's the belief about the event that creates either good stress or bad stress. So it helps you handle it in a positive manner versus a negative one.
Right.
So
it's more empowering when you
Yes.
know that you're in the driver's seat and you can
Yeah.
dictate how things go.
I mean, yeah, a lot of stuff stinks about what happens to you, but you can either stay in that bad part or you can find the positive in the reaction that you give towards it. So
Absolutely.
It's working a lot.
And that there is a very strong lesson what you said about cutting back to a half hour has been better for you, more sustainable. Sometimes we have a hard time, people can have a hard time stepping back because it's like going backwards.
Yeah.
But if it's more sustainable and can lead to consistency,
And
sometimes that's what we need.
It caused me a little bit of stress too because I kept trying to get to where I wanted to be and I wasn't able to get to there. So
Yeah.
I was just going to take a baby step and then I'll love it back.
Yeah, exactly. And sometimes that first baby step that then leads to the end result and the ultimate goal which you want.
Yeah.
But it just takes a couple of steps to get there.
So mainly with me, it was in the morning. I'm pretty regimented. We're at half an hour in the morning, but I was trying to do half an hour in the evening. Succeeding.
Yeah, that's actually one that I've recently found out is that the evening is not as good for me. All sorts of things can come up. Yeah.
Or I got family things that
Yeah.
demand my time. And by the time I'm ready to go to bed because I want to stay home. So.
Right, exactly. The morning is more consistent. There aren't as many things that are going on that can happen. It's usually you can make that time your own. Excellent. Good stuff.
Well, last week was hectic with the long days here, but I still was able to get to bed a little bit earlier.
Excellent.
And that was nice. Yeah, actually get a full night's sleep for going on a week now. So I'm actually waking up a little bit before the alarm. I'm not taking snooze a bunch of times. And kind of falling into that routine. So feel a lot better when you're waking up naturally.
Yeah.
Scared me.
Right. Or having to drag yourself out of bed after pressing snooze a couple of times. That's not the way to start the day.
That was my main thing after last week's meeting, was to try and get more rest.
Excellent.
And outside of that, I'm saying the typical stuff.
Great.
Good thing. So.
Good. Just adding one other facet of the wellness on top of it. Perfect.
And then you said after I'm getting more rest for a while.
Yeah, I think a lot of people struggle with that. It seems like especially guys. But it feels great to get that rest and relaxation. Waking up and being ready for the day makes all the world a difference. And Tim, something else you said that I've been thinking about recently is when you do one change, it seems to have a chain reaction of other healthy habits that come on board. So you mentioned the stress reduction in the book and trying new foods and recipes, things like that. It's just that's why success, even a small one in one area, it can snowball and create other successes in other healthy arenas. You might start with exercise and then you're eating better. And it's just a great way to get that positive momentum. So I'm very happy you made that shift. I was actually a little concerned when you said an hour every day, but I want to see how it played out. And I'm very happy with the decision you made. All right. Talk about pain. So what is pain? You know it hurts. But what's the mechanism? What's the use? So pain is a message from the brain that there is a threat, whether real or perceived. So it's basically your brain telling you that there is danger and that you need to be aware of it. And this may be danger that actually exists. Maybe there's something going on if your foot hurts, some sort of damage that you need to tend to. But it's not always the case. Sometimes it could be perceived threat. And there's a gentleman from Australia, Lorimer Moseley, who talks about neurological stuff and pain. And he has a story that he tells that he was hiking in the bush and he felt a little nick on his leg and paid no attention to it. Next thing you knew, he woke up a few days later in the hospital and he almost died from a bite from the most venomous snake in the world. But it just felt like a little nick on his leg. About a year or two later, he goes back hiking, same area, and he feels another nick now. And this time he falls on the ground, pain shoots up his leg, he can't even stand, he's writhing in pain, and they're looking at what had happened, and they found out it was just a little twig that had nicked him. Now what was the difference? The difference was he had had that traumatic experience before where he almost died, and so when he got the same type of stimulus, same experience, it created pain in his body. But it wasn't any different. In fact, the second time it was less harmful. And it was just a little scratch. But the brain interprets it based on the threat that it perceives and that it thinks is there. And it may not always be accurate. And so there's a very strong mental, emotional component to pain, which we'll see as we go on. It can be physical, but it might be something else that's going on that isn't physical. And in fact, estimates say around 70% of chronic pain exists without anything going on in the area that's hurting. And so that's a very large number. We've got to look at other sources of pain. But when we look at pain, we have to consider, what do you do with it? Do you shoot the messenger or do you listen to the message? And a lot of times we are programmed to shoot the messenger. Take an NSAID, take an opiate, some sort of painkiller, just let it go away because it's a nuisance. And sometimes that is useful, sometimes that's necessary, but we do want to listen to the message. Otherwise, the signal gets louder and louder and louder, and damage can occur that we can't easily recover from. So what are the types of pain? Here are the more common ones. Nociceptive pain. It's like when you stub your toe. From a bruise, from an injury, that's the one that we usually think of when we think of pain. That's an acute type of pain. We have inflammatory. Rheumatoid arthritis is a very good example of this. There's an inflammatory response. As part of that response, chemicals are released that lead to increased sensitivity of the nerves, and that transmits pain. So anytime there's inflammation, there's going to be more pain. And this can come after the nociceptive in acute processes, but it can also be a chronic process. You have neuropathic pain. This is a lot of times seen in chronic conditions, especially diabetes, which we talked about last week. So a lot of diabetes patients, if they're uncontrolled, they'll get neuropathy of the feet, where the nerves start to die, and they transmit pain, and then as they continue to get injured, numbness and tingling, and then complete loss of sensation. This type of pain is coming from the nerves. So it might hurt in your leg, but it's not because of your leg. It's because of the nerve that's providing sensation to the area. There's visceral pain. Perfect example is heart attack, myocardial infarction, which we talked about week 2. That gives the pain pattern of down the left arm to the jaw. That's a visceral pain. And then psychosomatic. And the story that I mentioned illustrates this point of it could be coming from the mind. And so when we think about pain, we not only want to think about what's happening structurally, but also what is happening in the mind if there's stress, if there's traumas that are not being processed, because that will cause sensitization of the nervous system, which means the nervous system is more primed to transmit pain signals. Many causes of pain. This is just a drop in the bucket. Inflammation, like we talked about, chemicals are released, they cause pain. Structural stress or damage, just like your car. If your car is misaligned, it's going to cause wear and tear, and that's going to decrease the performance. Same thing with your body, but only we're alerted when that's happening, not by a light that comes on our dashboard, but it's pain that we experience. Unprocessed emotions or traumas. These can lead to physical pain. Again, if the brain thinks it's in trouble, if there is some sort of memory or emotion that has this sensation of threat or danger, the brain will process that as pain. Negative mindset, called catastrophizing. They can tell by the way people think about pain, talk about pain, how they're experiencing pain. And it actually it can make the pain worse. And so people that talk about their pain a lot, people that really own their pain or their entire day or week is revolving around pain. I can't do that because it's going to hurt too much, or all these, that type of mindset actually leads to increased sensitivity of the nerves and increased sensation of pain. Now, other people on the other side of the spectrum, you have people who completely ignore their pain, and there could be something that's very serious going on, and they're not really feeling it. That is not necessarily healthy either, because then you're completely avoiding the message. And so the balance is somewhere in the middle, where you're not blowing the pain out of proportion. It's not taking over your whole life, but you're also listening to it and heeding its warnings when it applies. And so I think that's where the balance is. Poor lifestyle, diet, exercise, sleep. Sleep, definitely, through the hormones, the hormonal changes if you're not getting sleep, especially with serotonin. Serotonin has a direct effect on the spinal cord, the pathways that come up. It goes down and shuts off pain to some degree, so it helps with our pain tolerance. But if we're not sleeping, our serotonin levels will be affected. And so sleep definitely helps. Exercise, a lot of effects, but the release of endorphins while we're exercising, that can help with our pain tolerance. But pain tolerance is seen to increase as when people exercise. And diet. See this all the time with diet. When people are eating foods that they're sensitive to that cause inflammation, they'll get pain throughout the body. They might just be sensitive somewhere, maybe some upper back stuff, or a lot of times people get hand swelling or pain, and they may not always know it or complain about it in the office, but then when they take foods out, like we put them on an elimination diet, they will notice that certain pains went away. When do you experience this?
Yep.
Yeah.
Yep. I've seen that on firsthand.
Yeah. Very common. And a lot of times people don't even think about it until it happens.
There was she was in a lot of pain with her knee and her hip and that kind of thing. And most of that's gone with her lower back and all that. And she took out a lot of things that were causing inflammation based on the doctor said strip away. She's been paid up. But,
Yeah.
because that you're in
Yeah, with pain, if there's one or a couple of sites of pain, that sounds more structural. But if there's pain throughout the body, there's something going on inside that's causing an increased incidence of this pain. Why is there pain everywhere? Is there a whole bunch of structural stuff going on? More likely it's something deeper. Okay, take a few minutes. One of the handouts is a pain chart. So do a quick body scan and mark any parts of the body that have any amount of pain or discomfort, and then next to it label it from 1 to 10. 1 is just slight discomfort, and 10 is you're about to pass out from it. And we'll use this next week when we talk about emotions and mindset. have any of those in common?
Yeah, that right shoulder thing, I think I told you there's about from the firewood thrown lock on my shoulder.
Mm.
And I told you I did therapy for probably 3.5, 4 months. Got an extended, and I never went to get it extended the second time. So I was on ibuprofen. He taught me a bunch of, exercises, range of motion, get my shoulder moving in a bunch of different directions. And I do them not faithfully, but I do when I feel that it stiffens up sometimes. And I try to just keep it exercise. But I mean, if I roll it, I can sometimes get a clip going in there. I'm not sure what it is. I don't know if they can get rid of it or not. I'm sure if I had like intensive physical therapy for 6 months or a year, it might be able to go away. I don't know. He never indicated to me that it would go away.
Okay. It's hard to tell. Does it help when you do it? Well,
Oh yeah.
okay.
When I do the exercises and everything and stay on it, yeah, it's looser and it's more free. And I notice that when I don't do it, and if I kind of take a break from doing the exercises, it kind of comes back in a little bit again. But it never really truly goes away.
Okay.
I don't know what's going on. It's some sort of tendon that goes down to my bicep, but it's also from my shoulder back. Stacking them up, and I don't know where that's at. But he used to massage it and he could work wonders when I was in that therapy. It's just expensive.
So you know how to manage it,
Yeah,
which is good.
yeah.
But
He
then,
says as long as I keep the range of motion of the exercises, he said you'll be fine. He says, but I can't guarantee it's going to work. I might just keep
Yeah.
going back up every moment or something.
yeah, that happens. Well, good. Okay, next we're going to talk about inflammation. So inflammation, like we mentioned, is one of the major causes of pain. And so what is inflammation? Because this is a topic that only gets one side of the story. And so we're going to talk about both sides. Inflammation is derived from the Latin word that means a setting on fire. It involves the immune system, it involves the vascular system, it involves local cell signaling, immune cells and cells releasing different chemicals, and it also involves the digestive tract, which is where food comes in. And we have two different types of inflammation, and it's really important to talk about both separately because one is considered, I would say, good, and the other is not as good, and in a lot of cases, bad. So acute inflammation, you get some sort of injury, irritation, trauma, and your body gets into action. It starts with the immune cells. They start releasing chemicals to tell the body something happened here. We need to take care of it. The vessels dilate. You get more blood, more growth factors to the area, platelets to the area to make sure you get it clocked. And then you get more growth factors, nutrients, blood to bring the raw materials to get repaired. And you get immune cells to eat up any debris or any pathogen that came in that needs to clear out. This is a good thing. And when it's all taken care of, it stops. The healing process is over. But it's really important to note that acute inflammation is our body's healing process. Without inflammation, we don't have healing. And if we do, it's very, very poor and it's very stunted. Now, we're taught a lot of times that when you get hurt and when something's swollen and painful and throbbing, take some aspirin, take some ibuprofen, throw some ice on it to let it go completely away. And while I do think those can be used, to benefit, I think a lot of times they're overdone, and we stop healing before we're done. And I think that's why a lot of people have these chronic issues, chronic pains, and injuries that never quite healed. Ever since this happened, my back's always goes out all the time, and I hear that a lot. I feel like we should be able to heal completely, especially up until advanced age. We should be able to heal completely and not have these long-term consequences. And a lot of it comes to healing properly, which we don't really know how to do, but we'll talk about that at the end. Chronic inflammation, it might be the same, it might start the same way. Maybe there's some sort of irritation or injury. But then what happens is, it never resolves. it starts to resolve, but then something happens and it comes back, and there's more inflammation. And then it may start to resolve and then it comes back. And you get a lot of flare ups with the chronic inflammation. Or it may just be so low grade that the person doesn't really notice it. They may just feel overall icky, a little tired, maybe a little stiff in the morning, but it's not enough to really ruin their day, and so they don't really notice it. But it's going on underneath. And one of the things that happens is when you have chronic inflammation, a different type of immune cell goes to the area. It used to be an immune cell called the neutrophil. Now they eat slowly, but they eat very carefully. And so they're able to, with surgical precision, take out the bad stuff and leave the good stuff. When you have chronic inflammation, after a few weeks, you have macrophages come to the area, and the neutrophils go away. The macrophages are very messy eaters. They eat quickly, but they end up spewing their juices, their digestive juices that will eat up any bacteria or debris that they swallow. They end up spilling that out, and then that starts damaging the healthy cells in the area. And that's how chronic inflammation causes damage to cells. And then as you get damaged tissues, what's going to happen? More inflammation. And the cycle just keeps repeating itself, and it just becomes a self-fulfilling process. And that's where, if this continues, you get cell death, tissue damage, organ dysfunction, disease, and then eventually death. And so what we really want to do is allow acute inflammation to happen and resolve. But when it comes to chronic inflammation, we want this to go away.
I see a lot of people that get stuck in that, and then they end up, to me, it looks like they're getting addicted to the meds that they're on is like a crutch. So
Yeah.
kind of live in that realm.
Yeah.
And I think it's sad when I see that, but I mean, those are the people that are in that cycle.
Yeah. With the NSAIDs, sometimes they're used, they're pop like candy, where it's just any ache or pain, it's just take a few of these. Mm-hmm.
I always question why do you get on the meds? You're not addressing the problem. You're just dealing with this. And it's just like it doesn't seem like you're dealing with the root cause.
Absolutely. And especially when you're taking the NSAIDs, one, they're not good on the digestive tract. They lead to a damage to the lining. And then they're also not good on the liver and kidney. The liver and kidney have to process them, and they're not good on those organs either. And I read an article that was talking about a link between NSAIDs and dementia. They're starting to explore this now. This may be a thing. And so, it used to be they seem harmless. Just take a few, and then as you get used to that, you'll have to take 3 or maybe 4. And as long as you don't overdose acutely, you'll be okay. But now we're seeing that there are long-term effects too. But then if you're taking any sort of opiate painkiller, those are really addicting. The leading cause of becoming a heroin addict is starting with the opiate painkillers, most addictive drug out
I
there.
guess the biggest thing I've seen in my life is my wife used to have a shoulder issue. She couldn't lift her one shoulder.
Mm.
It was from carrying babies. And then she was getting a cortisone shot with a needle like that down in her shoulder. She was doing it up east and then moved down here, and she was put it in it for 6 years. And she finally got to the right doctor that took her through physical therapy, and after like 6-7 month process, she did the cortisone shots and worked her right out of it. Just blew me away because she did try some other medications and stuff, but that was amazing. So that's
Yeah.
I never did like medicine or pills, but after seeing that, I kind of pushed away from them. That's the good.
Yeah.
I know if I have to, but I try to stay away from them. I'm very aware if you use it too long.
Right, exactly. I think that's the main thing. A good example is I threw my back out a couple years ago, and first day and a half it was very painful to the point where I couldn't move really much at all, and I couldn't sleep. Now that's the time where I took some ibuprofen so I could sleep and get some rest. But once I got to the point where it was tolerable, it wasn't comfortable, but it was at least somewhat tolerable, and I can get some rest, then I came off of it, and I addressed the root cause. If someone's getting a cortisone shot and they get it once and it fixes the problem, let's still look at some of the movement patterns or what may have caused it. But I am more okay with that than if you're getting it over and over again every 3 to 6 months for years and years. What's that doing? That's just pumping you full of cortisone. You're not fixing the problem that hasn't been addressed.
That's kind of what happened to shoulder. I had it going on
Mm-hmm.
And I just couldn't. I knew something was wrong. And I ended up going to physical therapist, and he started running that routine. And we were able to work it out. When I quit going there, I was fine, but it did creep back in. So I don't know if I should go back or not. To see if we can gel that way out.
When we get to some of the treatments at the end, remind me, and because there's a few that you may want to look into, especially since you know the exercises, so you know a lot of exercises, and you use them when you need them. So you already have that in your tool belt. There are some things that you can do that maybe can get to it from a different angle and help. What are the signs of acute inflammation? We know these. 5 cardinal signs: rubor, or redness; tumor, or swelling; dolor, or pain; color, which is heat; and functio lysis, loss of function. This is what happens during acute inflammation. Now, acute inflammation, like I said, is a necessary part of the healing process. And these things aren't necessarily bad. They're signs that acute inflammation is happening. In some cases, you don't want it going on, you want to address it. If there is a joint that's really red and swollen, you gotta go to the hospital and make sure it's not infected, for example. But in other cases, inflammation, when in balance, is a good thing because it's bringing blood to the area. For chronic inflammation, this is more of a slow burning fire. And it goes on and on and on. And the effects could be insidious, below the radar, and long term. It happens over time. The person may not even know that they're feeling worse from month to month to month. It could be such a slow process that it's below consciousness, and that's where it becomes very dangerous. Now, healthy tissue will become progressively injured and less functioning. And unfortunately, too many people suffer through it. I'm okay, I can get by, but they're not acknowledging the fact that it's getting worse over time, and there comes a point where the body just can't recover anymore, or it can recover a little bit, but not all the way. And so it's really important to address it early, because the earlier you address it, the easier of a fix it is. What are some diseases associated with chronic inflammation? The most deadly ones, basically. This is a list which is in no way exhaustive. Atherosclerosis, we talked about week 2. Obesity and weight gain, we talked about last week. Alzheimer's, we'll talk about next week. Arthritis, fibromyalgia, headaches, body pains, those are all related to pain syndrome. And actually, a lot of these are associated with pain. Cancer, Parkinson's. You have pain with a lot of these. Irritable bowel syndrome, absolutely. And so inflammation is a major factor, and it's the chronic inflammation. We don't need to be afraid of acute inflammation. Some causes of inflammation, other than the irritation injury side. Sleep deprivation. If you get less sleep, it's linked to systemic inflammation. So getting that 8 hours plus or minus 1, wherever your sweet spot is, that is very important. Chronic stress. With stress, cortisol is released. We talked about that week 2. Cortisol is a natural anti-inflammatory. But when it's released over time, the body adapts, where now it doesn't respond to cortisol the same way it used to. And so you get a rebound inflammation. So stress is linked to, over time, increases in inflammation. Certain foods you're eating, it could be ones that are common: eggs, nuts. Gluten for a lot of people is inflammatory. Sometimes it's foods that you would never expect. And this is why I recommend to people where if they are having gut issues but also wellness issues, to get a food allergy panel. When I got mine, lettuce and watermelon came back positive, which I would have never thought to take out. And sometimes what happens is if our gut is compromised, we're not going to have a gut element in this program, but we'll be talking about it in Lunch and Learns. If the gut lining is compromised and it's exposed, food can get in, and that's where most of your immune system is sitting. And so if the immune system sees this, it looks like an invasion, and so it starts inflammation. And studies show that inflammation in the gastrointestinal tract is linked to inflammation throughout the body. Once the immune system is activated, it starts to turn on body-wide.
What exactly are they talking about when they're using the term leaky gut?
So with leaky gut, your cells are, it's almost like a game of Red Rover. Everything, all the cells are locked in. And they do that so nothing can get by. And that's healthy because if you think about it, your GI tract is technically, the inside of your GI tract is technically the outside of your body. It goes in your mouth. It hasn't entered the inner part of your body. It's just in a tube that's going through it. And so it has to be very careful in what it lets through. And so you have these things called tight junctions and other things that hold the cells together. Now, if there's inflammation and swelling, the cells can get pulled apart, or there can be actual damage to the cells of those junctions, which leaves openings. And then those openings allow, whether it's pathogenic bugs or even undigested or not fully digested food stuff to get in there. And 80% of your immune system is right behind those walls. It's just like the guards just waiting to make sure nothing passes that shouldn't pass. When they see it go in, that's when inflammation starts, and that starts the process. And if this is happening every single meal, then we have chronic inflammation. Common issues of people, they get really tired immediately after they eat, headaches after they eat, and it could be right then or it could even be delayed. 24 to 48 hours
So
in that.
to work on that, you want to get rid of the inflammation in the GI tract
Yeah. You remove the
to
cause.
get the cells all tight again.
Exactly. So one thing that happens is, let's take lettuce for example for me. If I'm eating a lot of lettuce and I have leaky gut, the lettuce can just scoot in where it doesn't belong. And so the immune system is going to start reacting to it because it looks like an imposter. It doesn't mean that I'm allergic to lettuce, but the immune system has gotten used to seeing the lettuce come in, and so it's reacting to it and producing antibodies. So it's a sensitivity without being something that I am, let's say, genetically allergic to. Now, once I take that out of my gut, out of my diet, now the immune system isn't releasing antibodies and causing inflammation because they're not seeing it. Once the gut heals up, I can now put lettuce back in my diet because the immune system stopped making
Yeah, it wasn't
antibodies.
the lettuce that was the problem.
Yeah.
And how did they determine lettuce and watermelon? With their blood test? Or?
Blood tests. So they measure the antibodies in the blood. And so the antibodies are just showing what the immune system has reacted to. And it could be because just your body doesn't do well with it, and the immune system's always going to react to it. Or it could be it was just wrong place, wrong time. Your gut was exposed, you eat a lot of it, and so the immune system started to respond to it. And that's what we get. We get a lot of either I don't have any of this, or oh man, I eat that every day. And it's just because the immune system just got used to seeing it and started producing antibodies. And the antibodies go away in about 6 weeks. And so you take it out. We usually have people eliminate from the diet for 6 to 8 weeks. And while we do that, so keeping it out will keep inflammation at bay partially. We give things that keep inflammation even lower. Probiotics and fish oils are two of the top things to eat in that case. And then we also have a gut healing product that has certain herbs and has glutamine, which helps heal the gut lining. That way, now it's back together, there's integrity, and it won't respond to things that you're not truly allergic to. And then we have people put it in one at a time, put it in, see if you respond. If not, congratulations, it's back in your diet. If you do respond to it, put it back at the end of the list, and you try again later, because you may actually have a sensitivity to it. One example is for me in strawberries. I don't do well with strawberries, unless they're covered in chocolate, it turns out. But other than that.
So here with strawberries, if I eat too many strawberries, my elbows and knees itch.
Yeah. I've never heard of anyone else that has strawberries. I know it's out there, but yeah, that watermelon is pretty common, which I get. Watermelon can be hit or miss for me. I have to have small amounts if I'm going to eat it. And that's something that probably is going to be throughout my life.
At one point we got on this kick where we tons of blueberries and strawberries, and I would be sitting there, before bed watching TV, and I'm like, oh, it's hurting my knees are itching. And it was kind of on the front end of when you doing her sensitivity stuff. What are you eating a lot of right now? I'm like, oh, let me try it. So I took blueberries out, and it was still doing it. And gradually, you're adding each one of them back in, and it's not if I just have a couple strawberries.
Mm-hmm.
I eat a bunch, like a few days in a row.
Right.
But it's weird. But
it's interesting that you were able to work it out and figure it out.
yeah, well, she was, at the same time, she was watching everything she was eating, so she was kind of focused on it.
Yeah,
I
she had
haven't
mindset.
figured it out on my
Yeah.
own. I would have just spent there eating strawberries straight now.
Right, because I mean, let's face it, it's not a common connection that we're taught to make. You can eat some strawberries and your elbow itches. It just seems like a completely unrelated condition, and that's why a lot of people miss it. And people can have these things that get worse and worse and worse, and it's just some food that they're eating. And then when they take it out and pains go away, symptoms go away, it seems like magic, but it was just that was your body's way of saying we have inflammation, and it caused itchiness at the elbows. We don't know why that happened, but that's the way your body was responding.
So can that happen too? There was a period when I would eat like McDonald's French fries or something. It seemed to be like a starch like that, like a fast food French fry. If I ate them, my throat would feel like it would constrict, and I would get like you have to clear my throat and stuff. And I just quit eating, and I don't have that problem anymore. I don't know if it was just like an allergy or what, but it's just the process that I went through. Another one for me is like milk. If I drink too much
Mhm.
milk, I get like gastric, I get gassy. I get like,
Mhm.
I'll be like
Yeah.
for like an hour afterwards. So I kind of like watch my dairy intake. I eat it like for lunch.
Yeah.
So I mean, I just learned stuff like that just over time because I pay attention to my friends sometimes. But she's really younger than me.
So,
But yeah, I mean, I don't know. I guess it's just a matter of just being in touch with
absolutely.
what how you're reacting and what you're eating and what you're eating.
Exactly. And this is how this week ties with last week, that the food, pain, and other symptoms are very strongly related. And even just knowing that that could be a connection and to look and test it, that's worth right there, that the empowerment that you can actually try different things. Not just think, well, I don't know what to do, I'll just either have to live with it or take some meds.
But you do say that a blood test will confirm all that as well.
We always say a combination of the blood work and the clinical symptoms.
Okay.
Sometimes things pop up that maybe you don't react to. That would be a false positive. And some things that come back say you're okay, but you do know that you don't feel right when you eat it, and that's a false negative. Every test has them, and with food allergy tests, those are no exception. And so we tell them to combine. Don't go 100% just with the data, and listen to the clinical symptoms, but also we'll follow this.
And when it comes to the McDonald's stuff, I really don't care because it's happy to push that out.
Yeah, good riddance,
Yeah,
right?
exactly.
Yeah. Any reason to get that out of your life is a good one. Take a few moments now to answer the first two questions on the handout. If there are any chronic pains, we talked about arthritis, fibromyalgia, or any other chronic pain syndrome that may be prevalent in your family. And then if you yourself experience chronic pain and what may predispose you to it. Okay, let's talk about exercise. So what is the relationship between exercise and pain? Here are some interesting facts. First of all, with chronic pain, the pain threshold drops. So the more pain you experience on a daily basis, the more likely you are to experience more pain. And part of this is an important defense mechanism. Think of it this way. If there's something going on in your body that needs attention and you're not fixing the problem, what should the brain do? It should tell you more and louder to get your attention there. It's like if you didn't do your work, your boss would be on you more and more and more. It's just common sense. And so as we experience pain, it becomes this positive feedback loop where that we will experience more and more and more. And that's called sensitization, where the nerves are sensitized to produce more pain signals and send them to the brain. And the brain actually itself starts to remodel to experience more pain. Exercise improves the pain threshold. So that will increase or decrease your pain levels. Cardiovascular fitness is highly associated with a reduction in low back pain and knee pain. Now, a lot of this depends on what type of cardiovascular workout you're doing. If you're doing a lot of high intensity, if you're doing running and not running properly, that could increase knee and back pain. But a healthier cardiovascular system in itself will lead to less pain in the low back and knees. Exercise leads to the production of anti-inflammatory molecules within the body. And so instead of taking an NSAID, which is going to shut off inflammation, why not just do some exercise and get a similar effect, but it's healthier in many ways. And 20 minutes of exercise per day resulted in decreased inflammatory markers in a study in blood tests. So actually saw decreased markers just 20 minutes a day. So even with the 30 minutes, you're getting 10 bonus minutes. And this is where some people think that maybe they have to do 1 hour, an hour and a half, 2 hours. They have to do more. They need to go, they get to their goal immediately. 20 minutes a day. And 99% of people have 20 minutes a day. They have 20 minutes somewhere in their day. What are the benefits of regular activity? So it decreases, first of all cause mortality. So basically, the rate at which people die goes down if they're exercising regularly. It also decreases blood pressure, the bad cholesterol, which is the LDL, the overall risk of developing heart disease, stroke, the risk of type 2 diabetes, and we've talked about all of these but week 2 actually. The risk of some cancers, decreases weight, decreases the risk of cognitive decline and dementia, and symptoms of depression and anxiety. And we'll be discussing those next week. What does it enhance? It enhances insulin sensitivity and diabetes, and that will decrease blood sugar levels. It enhances the good cholesterol, the HDL, which acts as an antioxidant. We're going to talk about oxidation next week. It enhances bone mass, energy, and feelings of well-being and quality of life. It just makes sense to have regular activity. And again, it doesn't have to be triathlete training, just regular activity. But now, how do you exercise with chronic pain? This is a major issue. With people that have chronic pain, it could be a balancing act. Some people, if they exercise a little bit too much, they end up taking 2 steps forward and 3 steps back. And so, what are some good ways to exercise if you have chronic pain? Especially if you're prone to flare-ups. So the mantra of no pain, no gain is a horrible mantra to have if you have chronic pain. Because in that case, you end up just plateauing, or at worst, you're going backwards. And so you want to modify the exercise until you don't feel increased pain during the workout and even afterwards. And so I've had patients where they work out, they feel okay, but then that night they get a flare-up. Well, you did too much. It was either too long, too intense, too much volume. And so we need to step it down. Because a lot of times what happens is if you start to feel pain, too late. You should have stopped 10, 15, 20 minutes before, or even more. So with exercise, and Tim, this ties in perfectly with what you said, slow and steady progress. Start somewhere that's sustainable, that doesn't cause pain, and slowly increase because your body will adapt to that stress. It will get stronger, it will become more fit, and it will become less pain sensitized. And so that slow progress is sustainable and it will get you to your goals. Some really good ideas for exercising, especially for people with like back, knee issues, foot issues, anything that's affected by gravity. Swimming, walking in water, aqua aerobics, low impact. And so you're getting that cardiovascular fitness, that movement, that blood flow without the high impact on the joints and the musculoskeletal system. Low impact cardio, cycling and elliptical, this is really good too. Again, low impact on the joints, you're not getting as much damage, but you're getting the fitness. And then low weight strength training, calisthenics, yoga. And again, don't cause damage. Is there a...
I was gonna give them a yoga workout from the Team ODX.
Oh, yeah.
That was one of the ones that when I first started doing it, I kept skipping it. When I wanted to do that, and I tried it, and was like, kicking my butt.
Yeah.
Standing in one place and sweating and yeah. I need a thumb drive in my hand.
I got one to give you one of the
Awesome. Yeah, it's a different type of fitness. And it's definitely challenging. It's not just like it can be relaxing, but other times it can really kick butt. But it's going to be, if you do it right, it's low impact. It's not going to be like running on concrete. It's not going to be like doing, clean and jerks with hundreds of pounds. It's low impact on the joints and on the body, but you're still getting the movement, and you're still getting the cardiovascular fitness, and you're going to be getting strength gains as well. All great for pain. And one of the important things is consistency over intensity. If you're a weekend warrior and you exercise for 4 hours on one day, one weekend, that's not going to be as good as 20 or 30 minutes each and every day. The consistency is key. And so if you overdo it, that can affect the consistency. Not only can it affect your body as a whole and cause more pain, but it may not be sustainable. So whatever you can do consistently is the most important. Yeah, let's talk about 5 facets of wellness. There are, depending on your source, there are more than this, but here are some important facets. Strength, endurance, cardiovascular fitness, flexibility, which is sometimes, that ties into the yoga really well. Sometimes we neglect flexibility as males, and our ability to recover. Now, all of these affect pain. We already talked about cardiovascular. Let's talk about flexibility a little bit. One way that flexibility can decrease pain is by strengthening the stability of joints and by preventing injury. So when you are exercising, the joints are more supple, the soft tissue and the connective tissue around it are not as prone to tears. And so it can promote more life into your joints. And especially certain things like tendonitis. Like I have some shoulder issues actually, and stretching helps it a lot. And it's just about stretching that tendon, bringing blood to the area, and also that way when it's in normal position, it's not stretched at all because I've stretched it before. So flexibility is important, and recovery. And we're going to get into this when we talk about the high intensity interval training. How quickly you recover from something is a great sign of how fit you are. So one way to practice that is to do intervals. Do a high intensity and then work on the recovery and try to recover as quickly as you can. There's many ways to do it. What are some of the reasons that keep us from exercising? So let's dispel these right now.
That's a good picture.
Tired? Okay. Well, you'll get more energy out of it. Usually the first couple days, let's say you're exercising in the morning. First couple days you might feel tired afterwards. But after you get over that hump, you'll feel more energy from it. Not only when you wake up, but throughout the day you're going to feel energized from the exercise. One caveat to this is if you're not getting adequate sleep, if you're not getting adequate nutrition, you don't have the resources, and that's why you're tired, then you really want to address those. Exercise and recovery go hand in hand. If you're not getting the sleep and the stress reduction, and you're not getting the raw materials to be healthy, exercise can cause damage because you're working when you don't have the materials to work. Maybe you're in a bad mood, you don't feel like it. Well, it'll give you a boost of endorphins, and it will create more balance in neurotransmitters, and it can elevate your serotonin levels if those are low. So that's good. If you're hurting somewhere, talked about that. Engage in low impact exercises that will get the benefits without the drawbacks. Don't have time? It can be as little as 20 minutes a day. And you might want to try some high intensity interval training where you can work on a few facets of wellness and not spend too much time. So let's talk about that. There are many ways to do high intensity interval training, many different ways. And so I always encourage people to try to do the one that works for them, that they will likely change it as they get more fit, and definitely talk to your physician first, because we're creating stress, and your doctor will be able to let you know how much stress your body can tolerate, especially your cardiovascular system. The basic principle is you alternate exertion with rest. Recovery is so important. And if you recover faster, that's a really good sign of fitness and health. I had some friends that were pretty high-level swimmers and were pretty much the tier below Olympic swimmers. And they said what they would do in training is they do their swimming and they do it at a high intensity, and then they stop and they measure their pulse. And they had to get it below, I think 120 was the number, as quickly as they could. And that was a really good sign if they could get it to drop quickly. And so this is training that. And it's going to be great for the cardiovascular system. And the theory is that you will continue to burn calories. It's going to increase your basal metabolic rate, where that you're burning more while you're at rest. So with the exertion, stay within your limits. It's really important to take it where you're at, check with your physician. But each stint of exertion, around, let's say, 45 to 90 seconds. And basically you want to get it to, by the end of that, you're huffing and puffing. Or whatever, wherever you're at. And then rest. Now, the more you relax, the better, in my opinion. Some people go from running to maybe they may sprint and then go to a light jog, or sprint to a walk. I like sprint to complete rest, but this is the most taxing on the body to make that big of a change and then go back to sprint. And so, again, wherever you're at, that's where you start. Focus on your breath. Focus on relaxing, slow your heart rate. Rest between 45 seconds and 3 minutes. When you first start it, you'll need more time, because the body's going to have to work to get back to that rested state. As you get more fit, you can do more exertion and less rest. But you want to pick some heart rate that you get below and see how long it takes you to get there, and that could be your next level. So what is the ratio? You might want to try a 1-to-1 ratio to start. 45 seconds exertion, 45 seconds rest. If you don't feel like you're getting enough rest, increase it. Increase it to 45 seconds and 60, 45 and 90. Play around with it. It doesn't matter where you start, it's all about where you end. And over time, you will get quicker recovery. And you can do this for 15 minutes for longer, but if you do, let's say you're doing 45 seconds and 75 seconds, so those would be 2-minute blocks. If you do 7 sets of that, that's 14 minutes. And I think 7 plus or minus a couple is a really good number of the amount of intervals to do. And it's a workout. It is an intense workout. All right, so what are some treatments for pain? We have some things you can do at home. We have some lifestyle treatments, of course, and then professional treatments. Talk about the at-home ones. They're the ones you can do. Ball rolling. You want to do ball rolling? Get a foam roller. So it's like a cylinder, long cylinder of foam. And you just roll over at different parts. It can be an arm, it could be a leg, and your body weight against the foam. And as it rolls across the muscles, it's like getting a rolling pin, which you can also use a rolling pin. And just, yeah, and you just work out the muscle. If you're at all sore, you may not even know you're sore. It can be really tender, but it can just help. It helps with circulation, releasing tension, and it can help with injuries. Really effective, and they're cheap. It's a really cheap therapy to have at home.
I think the foam roller we got like sports ability or something.
Yeah.
The other one, it looks like a rolling pin. You could use it just a regular rolling pin. It's the one I got looks like bike grips on the ends, and then it's got bearings. And like after a long ride, back of my legs and calves and everything, it's great.
Oh yeah. Yeah, just get in, especially for proactive like that. Get the lactic acid out of the area, which I mean that actually may not be what causes the soreness, but basically getting a lot of swelling, inflammation, get some circulation in the area. Great way to just
And then you actually roll it on tennis ball. So just put it on the wall.
yes.
She has a spot like you were saying, one particular spot. She'll just roll it, while she's watching TV.
Yeah. For those in between the shoulder blades and up on the back, upper back area, tennis ball, lacrosse ball. If it's a very small area and then you have a higher tolerance for pain, you can do like a golf ball or something harder, softball. I would do softball for my hip when I was rehabbing my hip.
When I was in therapy, he used it was almost like a butter knife, like a thick butter knife.
Mm.
And he would like drag it on the muscles, and he said it would help like break. Because when your muscles, he says they get tense and they tend to like clench and close up, and when he stretches them out like that, it literally, like he said, it breaks and stretches the muscle, and it creates blood flow over the entire area, which promotes it to rebuild itself, in a more relaxed state. Because when it's tense, the guy was really good.
You know where they got that from?
Uh-uh.
That's a Chinese medicine technique. It's
Really?
around for thousands of
Oh,
years.
it's so great.
Yeah.
I mean, it would kind of like hurt a little bit when he did it, and it would make you red like on the area. But he says, he says it would promote like direct blood flow in that area, and it would stretch. And I don't know what the term was. He says it would like break the muscle.
Yeah.
And the blood flow would promote like healthy growth and relaxed healthy growth.
It helps break up any fascial adhesions, any sort of scar tissue that may have formed, any fibrous tissue. It can help break it up. And you do it until you get that redness, that bruised look, because you want to break the capillaries open, because that's going to get blood flow, platelets, and growth factors. And so it can be tender, but it can feel good too, and it's strangely effective.
Afterwards, it was good too. But you got to do it while you're exercising. You can't do that without the exercise.
Hua Sha is the Chinese medicine term for it. Yeah, they have different tools. Physical therapists use it a lot. Physical therapists are doing dry needling too. They're starting to adopt a lot of the Chinese medicine modalities because it's just they work very well for pain.
And I like that roller thing. Some of the hiking I've been doing is serious, higher elevation on that 6,000-7,000 feet up there. The cardio I can feel, I can feel my body purging. So I just feel everything pumping and getting the blood up there.
Yeah.
It's just a good exercise.
Yeah, and you're getting those the up and down. It's really good.
And then in the process, like I said, I'm looking for actions and stuff. I'm enjoying myself all
Yeah.
But it is cool because the territories like it, I've been out there for ages. People in my town, why do you want to go up and down that? Because I can.
Yep, that's my reason for not taking elevators. I got legs that work for now. Some people would kill to take the stairs, and so while I can, I'm going to. Contrast hydrotherapy. So I mentioned ice before, in a slightly derogatory way. I'm not against ice, but I am against ice in a lot of the way that's promoted to be used, which is the 20 minutes, wait until it goes numb, and then wait longer, keep it on. I don't think that's good, and I've seen some studies, nothing conclusive, that shows that it actually is not doing what we want it to do, and actually can cause harm to the tissue in the area. And think about it, you're freezing tissue. That doesn't sound good, really. And plus, it doesn't make sense. You're going exactly against what the body wants to do. Inflammation wants to bring blood and nutrients to the area, and you're putting this ice pack, keeping it out. And so it's in direct competition with the body. So is all ice bad? No. I like contrast hydrotherapy, where you do alternating hot and cold. Or if it's an acute scenario, maybe you don't do the hot, but you just alternate the ice 3 to 5 minutes on, take away for a few minutes, 3 to 5 minutes on, take away for 5 minutes. Because in that way, what it's doing is hot will bring blood to the area, cold sends it away. And so you get good stuff to the area, bad stuff away, good stuff to the area, bad stuff away. And that pumping action is going to get a lot of healing to the area. And if it's an acute scenario, the inflammation is the hot. And then you just alternate with cold to provide that stimulation to get the fluid away. And so contrast hydrotherapy, you can do it with towels, you can do it with packs, you can do it with a shower and a hot tub. If you want to do full body, great way to wake up in the morning if you're dragging a little bit, alternate between hot and cold in your shower. 15 to 30 seconds cold, and then go back to hot, and do that a couple times. You want to end on cold, as much as that may sound like it's not a good thing. You want to end on cold, you're going to feel invigorated, and it just wakes you up. Epsom salt baths, we've heard of these, right? Put the Epsom salt, bathe the tissues. It's good for the musculoskeletal system, especially if there's an inflammatory process. My grandma had arthritis, and we used to bring her back water from the ocean because the salt helped her arthritis, and she put her feet and her hands in there, and it would help. And so that's the idea between the Epsom salt baths. It can help if you do a lot of exercise and to stave off soreness, or it can help if there's some active inflammation to help relieve it. You can do a full body bath, or you can do it in buckets if it's something a smaller area. Topical liniments, Biofreeze, Tiger Balm. I use a Chinese medicine one, Zhenggu Shui. Anything that they usually have camphor and menthol in them. They might have some wintergreen. Usually has that cool, piney type of smell. But there are other liniments too. Lavender can be anti-inflammatory topically. But there's a lot of things that when you put it over the area, it creates a topical, an anti-inflammatory response that is more soothing than something like an NSAID, which is just the way they work. They just completely block the pathway. This is more encouraging it to keep balance and to resolve the inflammation in a healthy way. But these are also great because they encourage blood flow, which is really important. Lifestyle, we talked about the exercise, talked about the role of stress. So stress reduction can help with pain. Mindset, which we'll talk about next week. I was getting some dental work last week, and whenever there was pain, I kept telling myself, this is good. It's good. I'm getting cleaned out. I'm going to be healthy. There's no damage occurring. You're okay. And the pain would go away. Just reminding myself that there's no threat, there's no danger, it's okay. But that mindset is really important. Food, we talked about food. So common lifestyle stuff can help pain. What are some professional things? Massage, especially if there's a tight muscle, if there's any sort of fascial adhesions that we talked about, scar tissue, you can break it up and it's going to get blood flow. And I would pick Gua Sha is a massage type tool. It's massaging the tissues. Chiropractic, something's out of alignment, especially if it's a vertebrae and it might be impinging on a nerve, or even if it's just any joint that is just not in placement. It's a structural issue that is causing wear and tear or is decreasing function because it's just not properly balanced in structure. There's one phrase that structure dictates function, and so if you have proper structure, you can have proper function, and that's where chiropractors play a role. Physical therapy, we talked about that, not only with some of the new tools they have, but also with the idea that maybe the structure is out of balance because there's a muscular imbalance, or maybe it's a functional movement imbalance, that the movement is improper. This happens a lot with the shoulders, where that the shoulders, some people, especially if they get injured, they start moving their shoulder a lot with the traps, and they're not using their rotator cuff muscles and other scapula stabilizers. There's 21 muscles of the shoulder girdle, and sometimes one or a couple can start to act out of balance. And that the shoulder is so delicate, if it's not aligned properly, if it's not moving properly, it can cause pain. And so physical therapists can help retrain the movement and help with better posture and better muscle tone that's balanced. Also happens with the knees a lot. People, a lot of times, they're runners. The outer part of the thighs are stronger than the inner part, pulls the kneecap out, and now it's not tracking properly in the leg, and it causes wear and tear of the cartilage. And so with them, a lot of things, they talk about patellar tracking. They want to strengthen the inner thighs. And so now there's proper pull on either side, and it's going through that groove nice and smoothly. And so that's where physical therapy plays a role when there's a movement pattern issue. Acupuncture, whether it's the needles. Today on a patient, I did cupping. Uh, there's some. So my family did this. It actually wasn't done to me, but my grandma used to do this. Is get glass, and they would heat. They would put a penny on if there's some pain, or if the person was sick, they would put a penny on the skin, light a match, put the match on the penny to keep it from touching the skin, and then put the glass on top of that match. And the heat from the match creates a suction effect. Sorry, expands air. Put the glass over. As it cools, then it contracts and creates a suction effect as it cools. And then that suction effect creates circulation, which is good for pain. You can move it around to break up any sort of adhesions if there's any decrease in mobility. And in Chinese medicine, and I've seen it work wonders for this, acute inflammations, acute infections, especially upper respiratory or lower respiratory issues. Do right over, right in the back, and it can help knock it out. Really powerful, yeah. And so that's cupping, but it has great. And then cupping and gua sha go hand in hand. Gua sha is better for a area like the shoulder where you can't put the cups on, whereas the back where you have more flat area, you can do the cupping. It's really effective. They also have herbs. A big fan of herbs. We'll talk about that with supplements. Some supplements that are good. Glucosamine chondroitin. Probably heard of that one for cartilage issues. One that I like even more that a lot of my patients switch to is called BCQ. It's got bromelain, which is from pineapple, curcumin, which is from turmeric, and quercetin, which I think it's also in pineapple. I forgot where that comes from, but it's some fruit. But they're three anti-inflammatory, very potent anti-inflammatory chemicals, and they're in this recipe BCQ. Really effective anti-inflammatory. The first one I said wrong. It's not bromelain. It's boswellia, which is frankincense. Boswellia.
Frankincense.
Yeah.
I brought it up a couple weeks ago. I've been eating turmeric, just the root, half inch chunk every night. I've been with all the biking, I was having knee pain and that kind of thing. I don't know if that's what's helping, but I haven't had pain. So.
Oh, fantastic. Turmeric is so potent.
I'll tell you this: don't keep it in your mouth long,
Yeah.
because that's a serious orange dye. And
Oh, yeah.
I noticed it though, like right before bed, and I brushed my teeth, and my bristles were orange. I'm like, oh,
Yeah.
that was definitely indicated.
Yeah, and it'll stain the pots and pans and anything blended in, and if it gets on the
I
table.
don't mind the taste of it. Wendy couldn't eat it. She says it's hot, but it's not like ginger hot. It's close, but
Yeah. It's yeah, for some people it's hot, but yeah, I wouldn't put it in the same category as like ginger, garlic, chili peppers. It's a different type of hot, slower burn. But yeah, turmeric is one of those miracles, especially for pain, inflammation, cancer. It's really very popular in the arthritis.
It was just out here a couple months ago. He and I had never actually talked about that, but when he got here, flew in late, and it was get to the house. He ate something. He's like, I gotta go to bed, and then he threw in a cup of water in the microwave, and he got his bag out, and he had a jar of powdered turmeric, and he just mixed it in the hot water and slugged it down. And I was like, what are you drinking there? And he said it opens up. He has problems sleeping at night sometimes, kind of like an asthma type thing. And he said it just opens him up and does the trick. He makes like a tea out of it.
Interesting. One thing to tell them, but it sounds like it's working, but maybe to get even more benefit, it's activated. The two things that activates it are black pepper, and an oil based. The oil helps bring it into the body because it's
take it instead of just putting it in hot water.
Yeah, so a lot of times they recommend milk because it's got the fats and it's fat soluble, the important chemicals. And so putting in some sort of fat soluble emulsion helps get it into the body more effectively. And black pepper also activates. That's why it's cooked with black pepper and usually in a coconut milk or something like that, like a fatty substance. That's why it's yeah. They've seen in studies. So a lot of times you'll see a fatty acid matrix of curcuminoids in the supplements, and because that helps get into the body more efficiently, especially in the good supplements, you'll see they may be activated in different ways. And I would say lastly, fish oil, really good for pain. Powerful anti-inflammatory. A lot of people take fish oil for their joint pains. And it also helps the cardiovascular system. It can also help with cognition. There's a lot of things that help with. So that's another good supplement. Triglycerides, absolutely. Any others that you've heard of or can think of for pain?
You were talking about balance and everything, and I was rear-ended in a car accident and had some whiplash a little while ago, and the doctor that I had was awesome because he would explain to me what was going on. And he was into the homeopathy side of things, and he was pretty renowned. He used to drive the country. I can't think of his name right now because it was 6-7 years ago. But he got me doing spine exercises. He told me that everything in the electrical system and everything from the brain and the pain sensors comes down through your spine and branches out, like, in your neck to your arms, to your organs, to your lower extremities, to your legs. And, he kind of taught me that you can get on a wobble chair or whatever they call it, but I sit like on the edge of my coffee table. And I go through these range of motion, stretch like this, and it stretches your upper and exercises and takes the decompression out of your spinal joints and such, and then you lower it down to here, and it works the next 6 joints, and then you can kind of do this and go smaller and do some straight bend over. But like you were talking about balance and everything, paying attention to your posture, paying attention to your range of motion and everything, and resistance as well as strength exercises, like when I do the shoulder and elbow. I'll pull this way and then I'll push the other way and pull back too.
Yeah.
And he says, as long as you're doing that, you constantly, keep your stances like karate stances where you're solid footed and everything. So it's all about, balance and training your spine. I find that works miracles on me. I'd love to get an inversion table. And it does everything upside down. This is it. That's wonders for hip because it kind of stretches instead of decompresses.
I try to keep stuff that's high in leather as well. So, like pomegranate,
Grapes.
and then
Blueberries in that.
I think of the red grapes, the red wine, pomegranate. Might be some, but they have anthocyanin in another.
cold pressed beet juice, which is awesome. I
I
don't like beets.
I love
but
it.
cold, ice cold pressed beet juice is awesome.
Yeah, when you talk about the balance, proprioception is the body's awareness, that body awareness. We get signals from the joints. Now the interesting thing is that proprioception goes one pathway, pain goes another pathway, and there's a treatment where the back area of the spinal cord is stimulated with the electrodes that are put into the spinal cord, and somehow, and it might be from stimulation of that pathway, it turns off the pain pathway, which is in the front of the spinal cord. And so some people are thinking about that, the crosstalk between those two pathways. And if you stimulate one, it may shut off the other. And so that's where body awareness and things that require focusing on the position of the body and balance may be helping to turn off those pain signals, at least quiet them down.
It's interesting you should mention that because him and the chiropractor that I was talking to and the physical therapist, they both used a machine that they said like Lance Armstrong used where they took electrodes and they would put it like at the top of your spine, if it was my shoulder, they would put like electrodes on my arm and they would adjust the intensity and the frequency of the signals that would go through. And I mean to the point where like you can feel them but sometimes you can't. And you can feel the speed of how they go, and you can feel the strength. Sometimes it makes my arm twitch and turn it down and adjust it. But it was explained to me that the neural pathways and how the synapses fired in between them. When you have pain, that gets distorted, and like you said, your your brain and your signaling from your muscles back and forth gets kind of distorted, and that pathway gets messed up, and that's why you start to favor your shoulder things down or whatever.
Yeah.
But when they stimulate that and train that to fire the right frequencies and with the right intensities, it kind of rebuilds or reminds your. It's like doing exercise for your nervous system.
Yeah.
But I thought that's fascinating. I even have a book that I picked up called Cross Currents. It's about the human electrical system. It's pretty awesome.
Look at Chris Lamont, you know Chris Lamont? Yeah. He's having this terrible ghost or phantom pains after he had the leg amputated. And one of the things they had to do was to try and trick his brain with a mirror. Yeah. And have it so when he looked down, he saw another foot. And he was like, you're good, your leg's there. It's not. And it was a little bit, and he's like, you had to through a few weeks where it was just brutal pain. That in your head is in your foot or your ankle that's no longer there. It's just, I guess it's because that Ed now has all those things all terminated at that one spot. I guess it's your brain's trying to figure out what the heck is
Yeah.
going on.
Exactly. I mean, yeah, but it goes to show you that it doesn't have to be something that's obviously there's nothing going on there.
Right.
Yeah. Right. So that's yeah. Those are the things about pain that really show how complex it is, but also how much we do have control in our mind. That our mind is dictating a lot of it. And yeah, I've heard varying results on the mirror trick. But sometimes that mirror trick works, where the brain just sees it. Well, okay, we're okay.
Yeah.
So how to reduce reduce inflammation? This is more acute inflammation, local inflammation. So first of all, do you want to reduce it? How much do you want to reduce it? Remember, inflammation is healing when it's in the acute phase. And so in some cases, you may want to keep it in check, but not really make it go away. And so that's the first question you want to ask. Do you want to reduce it? And if so, by how much? Movement. Resting promotes stasis or a decrease in blood flow. So moving around, even if it's gentle movements, subtle movements, but consistent movement will get blood flow. It will help decrease inflammation and swelling. Alternating hot and cold. Ice alone has been shown to cause a rebound increase in swelling by its effects on the lymph, causes lymphatic swelling. Herbal or enzymatic anti-inflammatories, this could be topical or ingested. BCQ would be an herbal form, but there are some enzymes. Bromelain's one of them that I mentioned. Bromelain's one of the top ones as far as enzymes that can break down those proteins that are telling your body to be inflamed. You have a lot of options, but the main thing is encourage healing. And the last thing I will say is the old recommendation for injury was RICE, rest, ice, compression, elevation. Now, a lot of people are moving to MEAT, movement, yeah. And the other one's meth, so we'll just do MEAT, but the two. Movement, exercise, analgesia, and treatment. And so it's moving away from stopping blood flow with ice and elevation and compression, but now we're getting blood flow and we're reinstating movement so that we can get our body healthy again. And so that's why I usually recommend, and you definitely want to listen to your body. Okay, take...
Can you define analgesic?
Analgesic is a painkiller.
Okay.
And so whether it's an NSAID, it might be something more potent like an opiate. Maybe it's a Soma muscle relaxer. It can decrease the pain by relaxing the muscles. Or it could be something topical. You put on some Tiger Balm. Or maybe it's something BCQ you take in or some enzymes that you eat. Those can all... Or, I'd probably do a ginger turmeric tea. Is probably how I would approach it internally. Okay, take 1 to 2 minutes to just set a goal for this week, what you want to do this week to be healthy, and then we will review and look forward to next week. Okay. So we talked about pain affects a lot of people. Chronic pain affects 1 in 2 Americans, 50% of Americans, American adults. And we all suffer from pain at some point in our lives. Pain is a message. It's an important one. It's telling us that we might be in danger, that there's a threat, or maybe it might be real. It might just be perceived. But it tells us something is out of balance and something could use our help. And so we want to listen to the message. Always want to listen to the message and address anything that needs fixing. But then on top of that, healthy lifestyle, diet, exercise, stress reduction, and then a lot of home things we can do, a lot of professional help we can get to decrease pain. Because sometimes pain occurs and it starts to get a life of its own. But there are many ways we can do to address it. We don't have to pop pills for it. Extra resources. We have this exercise calorie chart. And so basically, we are always burning calories unless you are an intense endurance athlete. Most of the calories you burn are going to be at rest. And so a lot of that comes down to diet and training to have your body to increase your basal metabolic rate and to burn fat over carbs if you're looking to improve your body composition. But there's all sorts of ways to burn calories, and basically whatever you're at, do it because you're getting something done. The high intensity calisthenic workout, just one example of a way to do interval training. And this also involves calisthenics, where that you can get some strength training into. Because a lot of them involve either running or swimming, a lot of the aerobics. This has aerobics, but also strength tied in. But there's a lot of different ways to do it if you understand the principle. Anti-inflammatory foods, we've got the top 10 anti-inflammatory foods, and also the top 10 inflammatory foods. So, of course, we want to get more of the anti-inflammatory and less of the inflammatory. And so there's a lot of information there for you. And
I'm sorry.
go ahead.
Kelp. Is that kelp? Would you get like a crushed, ground up in a pill type kelp, or like something you'd actually get it and eat it?
Yeah, if you got it in food form, you would probably find it in like an Asian market,
Right.
like kelp and seaweed. But yeah, you can get it in. Sometimes they have it in powdered form. I've seen it in herb shops before. They'll have things like chlorella, spirulina. They might have some powdered kelp or seaweed in there too. And I've also seen it in capsule form as well. I tend to do the food whenever possible. Sometimes with with anything coming from China, you gotta be a little wary. But especially now with Fukushima too, and who knows what's floating around in the water. So I get concerned about that sometimes. But a lot of those sea-type plants that are very high in chlorophyll, those are very anti-inflammatory. So any of the seaweed family, algae family.
There's stuff that like sprouts, like in drought, you can get like drought packages or
Okay.
and stuff. But I made some shakes out of it. I don't know if they might eat it.
Yeah.
Bleed off of it again, but I mean, it's good.
Yeah, I'll have it sometimes with
It's easier to throw it in a shake, but you can kind of mix it with other stuff. But that
Yeah.
tastes very good.
shake or soup would probably be okay.
Like ramen, you can get it in bowl of ramen. You like ramen?
Any other questions on that? Or comments?
Sounds like you're into the anti-inflammatories with all the biking you do, and you bike a lot.
Ooh, and then the last thing, the hot and cold hydrotherapy. Just one example on how to do it. But again, there's many ways to do it if you understand the principle. Main principle is you want to start on hot and on cold. Those are the main rules, and you tailor the times based on your needs. Looking forward to next week. Next Wednesday, we're going to talk about aging. We're all aging, unavoidable. So what is happening as we get older, and what do we do about it? So how does aging affect our brain, our male system, and what is the mind-body connection? Because there is a strong connection between the mind and how the body ages and stuff that I was just learning in the process, which is pretty cool. And so we'll talk about that next week. So I hope to see you there. So in the meantime, have a healthy and happy week. See you guys next Wednesday.
All right. Hopefully we'll get a couple